My name is Dr. Blaine Butterworth, and I'm a physical therapist. If you are struggling with pain in the front of your hip when squatting or bending over, you likely have anterior hip impingement. Here are the 5 battle-tested exercises I prescribe to get patients out of pain and back to lifting. So the first one is a hip flexor stretch. Tight hip flexors or a tight front of the hip is a common culprit of pain in the front of the hip and hip impingement. A tight hip joint or muscles can cause abnormal motion of the hip socket. This leads to the leg bone or femur pinching on the pelvis and the hip. This is one of the simplest and most effective exercises for hip impingement. Here's how to perform a hip flexor stretch. Begin in a kneeling position on the floor. Place a cushion or a yoga mat under your knees for comfort. Step your right foot forward into a lunge. Your right knee should be above your ankle at around a 90-degree angle. Your left knee should remain on the ground with your left foot pointing back. Engage your core, tuck your butt in to shift your pelvis into a forward position. This helps to isolate the stretch in the hip flexors. Slowly lift your weight forward into the lunge, lowering your hips towards the ground. You should feel a stretch along the front of your left hip and thigh. Keep your chest upright and your spine neutral. Avoid arching your lower back, otherwise you'll lose the stretch. Maintain the stretch for 20 to 30 seconds, inhaling fully. The next exercise is a quadruped sit back. So this is one of my favorite exercises for any patient who has hip impingement or lacks hip mobility at all. This one's a non-negotiable. This is my go-to exercise for hip impingement during squats. Most of the time, when performing this exercise, you can bend your hip more before it hurts or pinches. Before you try this exercise, lie on your back and bring your knee towards your chest. Remember how much your hip bends before you feel worse, like pain, pinching, clicking, or just increased symptoms. So here's how you do the exercise. Begin in all fours in a quadruped position. Your hands should be under your shoulders. Your knees should be under your hips. Keep your back flat and engage your core. As you sit back, aim to bring your glute towards your heels while maintaining a neutral spine. Keep your arms extended in front of you. Your head should follow your spine, looking down at the floor. Only go as far as your mobility allows without discomfort. You should feel a stretch in your hips and lower back. If you are still experiencing a pinch or increased symptoms in the hip, try tucking your butt. Your lower back should round slightly. This activates your glutes and core. This helps prevent the pinching of your hip. You should be able to go deeper before experiencing hip pain or pinch. After doing this, go on your back, bend your legs, see if you can go any further if there's less symptoms. If there are, you're golden. The next exercise is a banded hip flexion mobilization. So this is one of my favorite exercises for pinching over the hip when it's kind of really painful. Of all the impingement syndrome treatment exercises, this one is great if your hip pain is really bad or in the acute phase. For this one, there are 2 positions to try. One is with the band anchored next to the hip. So if your right hip is the affected one, you would anchor the band to your right side. The other position is with the band pulling downward, aiming the force towards your feet. You can also try pretty much any angle between these 2 positions to find the one that works best for you. To know if this exercise is effective for you, you should experiencing one of these 3 things: less pain when bending your hips, ability to bend your hip more before pain starts, or a stretching sensation in the hips. If you're not experiencing this one, try putting more tension on the band or changing the direction that the band is pulling. If none of this kind of helps, I would recommend trying one of these other exercises on the list. So here's how to perform this exercise. Anchor a heavy resistance band to a stable structure such as a squat rack. Line your back so the band is pulling directly towards your feet. Next, grab the resistance band and loop it through your thigh. Place the resistance band as far down your leg into your groin as possible. Scoot away from the anchor point so there's a considerable amount of resistance in the band. Grab behind your thigh and pull your knee to your chest. You can use a towel to help with this. You should be experiencing at least one of the following things. You should feel less pain when bending your hip. You should be able to bend your hip further before feeling the pinch or increased pain and symptoms. You should feel a stretch in your hip while bending it. When you finish, you notice that you can bend your hip further before you feel pain, pinching, or clicking. If you're experiencing none of these, try turning your body so the band is pulling more sideways instead of towards your feet. If it's your right hip, it should be pulling more towards your right side. Give it a go again. If none of these help, I'd skip this exercise and try one of these other ones. This next exercise is great for strengthening hips with hip impingement. It's called furniture slider squats. So this is my favorite for anterior hip or groin pain when it comes to strengthening. It focuses on the strength and stability of one leg at a time. Of all the hip pain physiotherapy exercise, this one is pretty much strengthens all the hip muscles. With this exercise, you get the most bang for your buck out of all the physical therapy hip exercises. Typically, a single leg squat is too difficult and frankly too unstable for most. However, the slider lets you keep both feet on the ground. This lets you focus on the single leg strength, not the balance. You can use a towel on a hardwood or tile floor if you don't have a furniture slider. If you're on carpet, you can try using a Tupperware container. You just have to find one large enough for your foot. Furniture slider squats are great for the legs, glutes, and core. They also improve balance and stability. Here's how to perform them. Stand with your feet shoulder width apart. Place a furniture slider, towel, or plastic container under one foot. You should point your toes forward and place your hands on your hips or extend them in front of you for balance. You can also perform this next to a counter for balance. The slider is on your left side. I would position yourself so the counter is on your right side and vice versa. Engage your core. Lower into a squat by bending your knees and pushing your hips back as if sitting in a chair. As you squat down, slide one foot out to the side. Keep it straight while bending the other leg. The leg that slides out should remain extended with your weight focused on the leg that is bending. Stand back up to the starting position, keeping your movements controlled and smooth. I recommend performing the exercise forward, to the side, and backward. When performing this exercise to the side, you end up working a little bit more of the adductors. When going backwards, you hit more of the hamstrings and glutes. So if this exercise was a little bit too difficult for you, I got a bonus exercise. They're called heel taps. To form this one, you need either a yoga block, a thick textbook, or a stair. This exercise works many of the same muscles of the furniture slider. It's usually easier to coordinate. Here's how to perform it. Stand with one foot on a step, a yoga block, or a thick textbook, with the other foot hanging off the side above the ground. Keep your feet about hip width apart and your hands and your hips are extended in front of you for balance. Engage your core and maintain an upright posture with your chest lifted. Lower your knee into a bent position, placing your foot on the step or block. Lower your body while keeping the other foot off the ground. Your goal is to lightly tap your heel on the floor without fully resting your weight on it. I like to imagine there's an egg on the ground. Try to tap the egg, but don't crack it. Push the heel on the foot, on the step, or block to straighten your leg and return to the starting position. So if you're using a step is around 3 times as tall as a yoga block. As a result, if you're using a step, I would recommend not trying to tap your foot on the ground as just too hard for most people. Instead, aim to complete half or less of the distance. Put something on the ground next to the step. It will give you a target for consistency of how far to go down. These hip strengthening exercises will help strengthen your hip muscles and relieve pain. So if you found these exercises helpful for your hip pain but want to fix your hip pain for good, need additional help, you can always reach out in the comments. There to answer questions. Peace out, guys.